In this podcast episode, Dr. Natalie Crawford, a double board-certified physician specializing in obstetrics, gynecology, and reproductive endocrinology, discusses actionable insights around fertility and hormone health for women. She elaborates on how fertility is not just about the ability to conceive, but also a critical marker of overall health and longevity. The discussion covers topics such as ovarian reserve testing, hormone replacement therapy, the impact of lifestyle and environmental factors on fertility, implications of age on reproductive potential, and advanced reproductive technologies. Dr. Crawford also highlights the importance of self-advocacy, awareness of endocrine disruptors, and new therapeutic strategies emerging in this field. Fertility reflects much more than just a woman's capacity to become pregnant. It serves as a window into her hormonal, metabolic, and cellular health. Normal ovulatory function requires intricate communication between the brain and ovaries and depends on good overall health. Infertility often signals chronic underlying conditions, such as insulin resistance or chronic inflammation, that elevate risks for metabolic syndrome, cardiovascular disease, cancer, and premature mortality. Even women who have reached perimenopause retain informative menstrual cycles indicating hormonal health, as menopause is technically defined only after 12 consecutive months without periods. Hormonal changes preceding menopause can affect systemic health, and hormone replacement therapies, HRT, are increasingly seen as beneficial for cardioprotection, cognitive health, and bone density. Dr. Crawford advocates for a more flexible and proactive approach to HRT initiation rather than waiting for strict diagnostic cutoffs, which often leave women feeling dismissed or neglected. AMH, secreted by granulosa cells surrounding ovarian follicles, serves as a relatively simple blood biomarker to estimate ovarian reserve, the quantity of remaining eggs. Although not a direct measure of egg quality, AMH provides valuable insight into reproductive timelines and family planning. Despite its clinical utility, professional guidelines discourage AMH testing for women without diagnosed infertility, mainly due to concerns about stress caused by low results without clear predictive value for fertility. Dr. Crawford challenges this view, urging every woman who might want children someday to obtain an AMH test. Knowledge of ovarian reserve enables informed decisions about fertility preservation, lifestyle interventions, and timely evaluation for underlying causes such as autoimmune diseases or endometriosis. She stresses that even though AMH can fluctuate, a critically low level impacts treatment outcomes like egg freezing and IVF, indicating urgency for intervention or counseling. Egg quality involves genetic competence and mitochondrial health, essential for embryo development and successful pregnancy, factors strongly tied to biological age. Women are born with a finite number of eggs arrested in meiosis that deteriorate over time, with the chromosomes inside the eggs vulnerable to cumulative damage with age and metabolic stress. Egg quality declines notably after age 35 due to increased chromosomal abnormalities linked to oxidative stress and mitochondrial dysfunction. While ovarian reserve and egg quantity can be approximated with AMH, there is no direct clinical test yet for egg quality. Metabolic health, chronic inflammation, and insulin resistance all aggravate age-related fertility decline, demonstrating the critical interplay between lifestyle and reproductive potential. Having carried a previous pregnancy can statistically improve the chance of conceiving again under the same conditions, as it confirms sperm viability, ovulatory function, and at least one properly functioning fallopian tube. However, secondary infertility, difficulty conceiving after a prior pregnancy, is common and often unanticipated. Age-related factors, evolving sperm quality, emergent reproductive tract conditions like endometriosis, and lifestyle changes also influence future fertility. Pregnancy loss, while emotionally devastating, generally indicates functional reproductive anatomy and physiology if occurring early and isolated. Recurrent pregnancy loss, however, necessitates earlier evaluation to investigate underlying causes before additional losses occur. Dr. Crawford advocates for a nuanced understanding of hormone therapies encompassing replacement for outright deficiency, augmentation, optimizing within normal ranges, and supraphysiological use. Estrogen replacement is often key in perimenopause and menopause to counteract the inflammatory and metabolic changes accompanying ovarian failure. Progesterone and, less commonly, testosterone replacements can be tailored depending on symptoms and individual hormonal status. She emphasizes that hormone therapies should not be withheld until strict diagnostic time points, such as 12 months of amenorrhea, as hormonal deficiencies profoundly affect quality of life and long-term health risks for women. Sleep, stress management, muscle mass, nutrition, and exposure to toxins constitute the 5 non-negotiables for supporting fertility and hormonal health. Sleep strongly influences hormonal release rhythms, including gonadotropins. Poor sleep correlates with lower egg numbers and poorer sperm parameters. Chronic inflammation worsens both egg quality and ovarian lifespan, making anti-inflammatory habits critical. Reducing exposure to plastic-derived endocrine disruptors, avoiding smoking, cannabis, excess alcohol, and oral nicotine, and managing diet quality all contribute significantly. Cannabis use, particularly in males, is strongly linked to impaired sperm quality and elevated miscarriage risk. Nicotine, especially in any form, negatively impacts egg count and quality and sperm parameters. Acute inflammation is a physiological requirement for ovulation and implantation, but chronic inflammation damages ovarian function and egg quality. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can inhibit ovulation if taken outside the menstrual period and should be used cautiously when trying to conceive. Chronic inflammation overlaps with insulin resistance and metabolic dysfunction, which also degrades egg health. Therapeutic approaches aim to rebalance inflammation without suppressing necessary acute immune functions, often through lifestyle changes complemented by careful supplementation. Evidence supports certain supplements such as coenzyme Q10, vitamin D, omega-3 fatty acids, and prenatal vitamins in supporting mitochondrial health, egg quality, and sperm parameters. L-carnitine benefits sperm health specifically. Emerging therapies include low-dose GLP-1 receptor agonists utilized experimentally for chronic inflammatory conditions like endometriosis and insulin resistance-related infertility. Human growth hormone has shown promise in improving egg quality and embryo development in IVF cycles, despite lacking formal FDA approval for this indication. Platelet-rich plasma, PRP, delivered either intrauterine or into the ovary, is an experimental intervention with modest evidence, especially for recurrent implantation failure and diminished ovarian reserve, but requires further validation. Egg freezing does not deplete ovarian reserve. It captures and preserves the eggs already naturally recruited in a single cycle, which would otherwise undergo atresia. The ovarian reserve diminishes continuously regardless of stimulation. Fertility preservation through egg freezing or embryo banking offers women extended reproductive options, especially useful for those delaying childbearing due to career or personal reasons. Coverage and accessibility of these technologies remain inconsistent and costly, although some tech companies provide egg freezing benefits to employees, which has been shown to increase worker retention and satisfaction. Ethical debates about embryo disposition in IVF exist, but patient autonomy and choice should be paramount. Most contraceptive methods do not impair long-term fertility, but discontinuation timelines vary by type. Combined oral contraceptives have a short half-life, and ovulation typically resumes within 1 month, but the underlying reason for pill use, e.g. PCOS, can affect fertility independently. Progesterone-releasing IUDs may suppress ovulation in the first 2 years and require up to 6 months after removal for endometrial recovery. Depo-Provera injections may delay fertility for up to 18 months. Dr. Crawford recommends stopping hormonal contraception at least 3 to 6 months prior to attempting conception to resume ovulation tracking and allow reproductive function normalization. Endocrine-disrupting chemicals found in plastics, fragrances, and personal care products have clear associations with longer time to pregnancy, poor IVF outcomes, decreased sperm quality, and earlier ovarian failure. Frequent low-level exposure, such as to phthalates in scented products or BPA in thermal paper receipts, is of most concern. True fragrance-free products are preferable to unscented, which often masks odors with other chemicals. Minimizing daily exposures in one's home and lifestyle can reduce inflammatory burden. Greenwashing of products remains confusing, so consumer education is essential. Advanced paternal age over 50 is linked with increased risks of offspring neurodevelopmental disorders, including autism and schizophrenia, due to DNA mutations. Lifestyle factors such as cannabis use and nicotine also reduce sperm count, motility, and DNA integrity, directly impacting embryo viability and pregnancy outcomes. Men desiring to maximize reproductive potential are encouraged to engage in anti-inflammatory behaviors and to avoid toxins at least 3 months prior to conception attempts or sperm banking. Dr. Crawford repeatedly underscores the need for patients to be proactive and informed about their reproductive health rather than passively waiting for medical gatekeepers to initiate testing or treatment. She critiques the current medical paradigm of wait and fail before investigation of infertility and calls for earlier screening and education, which empower individuals to make autonomous, timely decisions. Knowledge of one's body, menstrual cycle intricacies, ovulation patterns, and hormonal status facilitates better health outcomes and reduces emotional distress. Though not yet fully proven, low-level light therapies, including red and infrared light, are being explored for their potential to reduce systemic inflammation and improve ovarian function and egg quality. Devices delivering light to the abdomen or intravaginally are experimental but show promise. Innovations such as modified IVF lab environments, considering light exposure and mitochondrial function, may represent future fertility optimization tools. A nutrient-dense, anti-inflammatory diet rich in fiber, whole foods, plant proteins, omega-3s, and limiting ultra-processed foods aligns with improved fertility outcomes. Red meat consumption should be moderate, focusing on quality sources. An individualized approach testing reactions to various foods can help identify intolerances or sensitivities, e.g., histamine-related. Cholesterol intake is important for steroid hormone synthesis, including progesterone. Dietary interventions integrate with other lifestyle factors to cultivate overall resilience and hormonal balance. Cannabis, especially THC, crosses the placenta and disrupts hormone function and gamete quality, increasing miscarriage risk and reducing IVF success rates. Post-legalization increases in use make public awareness imperative, particularly since misconceptions and casual attitudes persist. Nicotine, including oral forms, negatively affects ovarian reserve and sperm quality and is best avoided during fertility planning. Elective or medically indicated pregnancy termination does not inherently impair future fertility, but complications such as infections or heavy bleeding requiring procedures can cause uterine scarring and reduce reproductive potential. Post-procedure menstrual changes warrant evaluation to exclude intrauterine adhesions or other pathologies. Though not the episode's focus, mental health support through therapy is implicitly important given the emotional challenges surrounding infertility and reproductive health. BetterHelp and similar services make counseling accessible and effective for many individuals navigating this journey. Dr. Crawford highlights that fertility and hormonal health concerns span beyond traditional reproductive-aged women, addressing metabolic, inflammatory, and hormonal health before, during, and after reproductive years, including perimenopause and postmenopause, is vital. Menstrual cycles remain valuable indicators of health, and hormone replacement therapies coupled with lifestyle interventions can improve quality of life and longevity. The episode emphasizes the critical role of enhanced public education, transparency, and destigmatization of fertility issues as more people openly share experiences around IVF, endometriosis, pregnancy loss, and reproductive challenges. This cultural shift fuels demand for research, improved clinical practices, and inclusive care models that respect patient autonomy and individualized treatment, aiming to optimize reproductive and general health.